This is Priyal Doshi. Today's podcast is Health in Context, where awareness becomes action. Who gets diagnosed early and who gets left behind? Welcome to Health in Context, where we go beyond awareness and ask the harder question: what actually needs to change in healthcare? I'm your host, Dr. Priyal Doshi, and today's episode sets the tone for our April series. This month is recognized as Autism Acceptance Month, and while breast cancer awareness is often highlighted in October, the conversations around early detection, equity, and access are just as urgent year around. So today, we are asking a fundamental question: who gets diagnosed early and who gets left behind? Let's start with a simple truth. Early diagnosis saves lives. In breast cancer, early detection dramatically increases survival rates. In autism, early diagnosis can unlock support, therapy, and improve long-term outcomes. But there is what we don't talk about enough. What happens mentally when diagnosis is delayed or missed entirely? Breast cancer, the screening gap. We often hear, get your yearly mammogram, but that assumes access to insurance, transportation time, and trust. When those don't exist, diagnosis comes later, and with late diagnosis comes more than physical impact. It brings anxiety and uncertainty, fear of the unknown, depression during prolonged treatment, trauma from navigating a fragmented system. For many patients, the emotional toll begins before treatment even starts, and when someone feels like the system failed them, that stress doesn't just disappear, it stays with them throughout survivorship. Pelvic health screening, the missing preventative care. When we think about screenings, we think about mammograms or blood pressure checks. But pelvic health screening is just as important and often completely overlooked. Just like with other conditions, early identification can prevent long term complications. Without screening, pelvic floor dysfunction can progress into chronic pain, sexual dysfunction, worsening incontinency, reduced quality of life, increased mental health strain, including anxiety, embarrassment. This is where pelvic health physical therapy comes in. Specialized physical therapists can assess pelvic floor muscle function, provide targeted exercises and treatment, address pain, weakness, or overactivity, help patients regain control and confidence, and in many cases, this care can prevent the need for medications or surgery. Autism diagnosis delay. Now let's talk about autism. When diagnosis is delayed, especially into adolescence or adulthood, the mental health impact can be profound. Many individuals grow up feeling different, but without understanding why, misunderstood or mislabeled. Socially isolated, some develop anxiety or depression, not because of autism itself, but because of the lack of recognition and support. There is also something called masking, where individuals suppress their natural behaviors to fit in. And while masking can make someone navigate social situations, it often leads to burnout, emotional exhaustion, identity confusion. So, again, the issue isn't just delayed diagnosis, it's delayed understanding of self. Public health, mental health is not separate. Here's where public health connects the dots. We often treat physical health and mental health as separate, but they are deeply intertwined. Delayed diagnosis affects stress levels. Trust in healthcare provides willingness to seek future care, and over time, that creates a cycle. Delayed care, worse outcomes, increased stress, avoidance of the system. Even later care, breaking that cycle requires more than awareness. It requires redesign. The role of AI and digital health. Now let's talk about where we are headed. We are entering in a new era of healthcare, one shaped by AI and digital innovation that is being used to detect cancer earlier through imaging analysis, identity patterns clinicians might miss, support decision making in diagnosis in autism, digital screening tools, and telehealth platforms are helping families access evaluations faster, especially in areas where specialists are limited, and apps like Teledoc are expanding access to both physical and mental healthcare from home. Can technology close the gap? Not entirely, but it can help bridge the gap. AI and digital health can bring screening tools to underserved communities, reduce wait times for diagnosis, offer mental health support through virtual care, personalized treatment, and follow up care. But there is a catch. Technology only works if people can access it. That means addressing internet access, digital literacy, trust in technology, data bias, and AI systems because if we are not careful, innovation can widen disparities instead of closing them. A more human future. The goal isn't to replace human care, it's to enhance it. Imagine a system where AI helps detect risk earlier, clinicians have more time to listen, mental health is integrated into every stage of care. Patients feel seen, heard, and supported. That's the future worth building. Here is the takeaway. Delayed diagnosis doesn't just affect the body, it affects the mind, the identity, and the entire life trajectory of a patient. And while the system has gaps, we now have tools and opportunities to start closing them. The question is, will we use them equitably? Next time, we will continue the conversations with a topic that often goes unseen, the invisible weight of caregiving and its impact across conditions. If this episode resonated with you, share it with someone who needs to hear it. And don't forget to follow Health in Context for more conversations that challenge how we think about healthcare. I'm Pril Doshi, and I'll see you next time. Bye bye.